Hi, and welcome back to Talk Sex with Dr. S. Dr. S, how have you been doing this
I've been
week?
doing well. How about you?
I've been doing pretty well.
Good.
So, we appreciate all the viewer comments and questions that we've been getting. And please remember to continue emailing us at talksexwithdrs@gmail.com. So, let's get to the questions,
Great.
shall
I'm
we?
ready.
Okay.
And this week, just to tell everybody, I don't know what they are, so it's going to be a surprise every time.
Surprise questions. So, the first question we had is I've heard that after a woman is a certain weight, the birth control pill is ineffective. Is there validity in that? And I myself have heard that from a biopsych perspective, that any drug is dependent on the weight of the individual
Mm-hmm.
taking, as well as age and whether or not the drug is taken by a male or a female. So, would that be the same with the birth control pill?
Exactly, yeah. There are a number of different things that determine whether or not a drug will be effective and what dose of drug you need. And one of those things is definitely body weight. I don't agree necessarily with what the person heard in that by the time you get to a certain weight the pill is ineffective. It's just that depending on weight, various pills will be effective. The new generation of them are low dose pills, and those may or may not be appropriate for overweight or certainly obese individuals.
So, when they end up, when your doctor ends up putting you on the pill,
Right.
do they end up taking your height, weight, all of that into perspective when they choose what type of pill you should be on?
Yeah, when you come in for the medical exam, just as with men going in for a medical exam, one of the first things they have you do is stand on the scale. They measure your height or they ask you how tall you are. It's not really as specific as it seems, in that they don't say, oh, you're 132 pounds, therefore you need this pill, but they'll generally look at increments of weight. So they do take that into account, and maybe increments of 20 or 30 pounds. And that also depends on height, believe it or not. You would think you could just go with weight. But because some people who are extremely tall and weigh a certain weight have less adipose or fat tissue than somebody who's short and weigh that same weight, that has to come into effect because the hormones that are in most birth control pills are actually stored in fat cells.
So, if you are also too thin, like if you don't weigh enough,
Mm-hmm.
will a birth control pill end up, I don't want to say not be effective, but could there be adverse, definite adverse side effects because of how much you end up taking in?
Usually we can find a low dose pill that's low enough for a person who weighs quite a bit less than the average woman. But back in the 70s, there were some really, really crazy things happening with women being prescribed all the same dose of the hormones, and women who weighed less had some really crazy side effects like hallucinations,
That had to have
delusions
been
of
fun.
being chased and put into
Okay, that
dangers.
wouldn't have been as
Yeah,
fun.
no. So
Some
they had
hallucinations probably would be fun, but
Right, and in
no.
fact, some of those side effects are the reason that every single drug that you're prescribed that you take now has a drug insert leaflet in it, is because of birth control pills and how crazy they made some women based on the fact that they didn't vary the dose by body weight. Yeah.
One of my friends has been having extreme pain in her lower abdomen during her menstrual cycle. Is this normal or is it a problem? And what can she do about it?
Okay, great. That's a really good question. Most women do have menstrual pain during their lives, and most women will say that at some point in their lives it has been described as severe pain, very serious pain. There are a number of things that you can do. Of course, this varies woman to woman, but you can get a prescription pain reliever. That is pretty rare. What we normally see is that you just take an over the counter pain reliever like aspirin, Tylenol, Motrin. These have anti inflammatory agents, and I'm going to tell you just briefly what a menstrual cramp is. There is the uterus, which we've talked about before, is about the shape and size of an inverted pear. There's a small opening that is the cervix, and then the vaginal canal is below that. Menstrual cramps result from blood passing through the really tiny opening of the cervix, and that cervix is extremely sensitive. And as just blood, the fluid is passing through, that's what causes a menstrual cramp. And sometimes the fluid is a little more viscous or a little thicker, and as it thickens, it becomes a more and more painful association with the menstrual cramp. So if you can take an anti-inflammatory, you're thinning blood, you're thinning down that liquid. So when you thin down the liquid, it passes through with less pain. So you definitely want to check with your doctor before you do even an over-the-counter anti-inflammatory, because aspirin has some side effects, as do the others. The other things you can do, and again, this varies woman to woman, but some people have found some success with dietary changes or lifestyle changes. And the science we're talking about here is behavioral medicine, just changing things on your own. One of the things you can do is avoid caffeine. For some reason, caffeine makes the menstrual cramps a little more difficult to take.
I know a lot of people are going to have a lot of difficulty with
Exactly,
that.
especially if we're dealing with college students, definitely, yeah. Caffeine is a staple on college campuses. But eliminating caffeine and also making sure that you're properly hydrated. And then some people find that it's only caffeine specific to certain beverages. So for example, some people can still drink the caffeine that you find in caffeinated sodas, but it happens from coffee. And the reason for this is all of these substances aren't really caffeine. They're methylxanthines. It's a whole other class of drugs. And as the different molecules are different for each woman, you may find that you can still drink coffee but not drink soda, or vice versa. So you just have to play around with that. And the other thing, of course, is exercise. Because exercise is anti-inflammatory, and because it sort of gets everything going, it'll make that flow a little thinner and the resulting pain a little bit less.